Medications to never take when you have kidney failure.
Kidney failure, also known as end-stage renal disease or ESRD, is a serious medical condition that affects millions of Americans. When the kidneys can no longer effectively filter waste and excess fluids from the body, patients often require medications to manage their health. However, not all medications are safe for individuals with kidney failure. In this video, we'll explore the top 10 medications that should never be taken by individuals with kidney failure in the United States. Number 10. Non-steroidal anti-inflammatory drugs or NSAIDs. Non-steroidal anti-inflammatory drugs or NSAIDs are a class of drugs commonly used to relieve pain and reduce inflammation. Some common examples include ibuprofen or Advil, naproxen or Aleve, and aspirin. For individuals with kidney failure, NSAIDs can worsen kidney function by causing vasoconstriction, reducing blood flow to the kidneys. A study published in the Journal of the American Society of Nephrology in 2019 found that the use of NSAIDs was associated with an increased risk of acute kidney injury in individuals with pre-existing kidney disease. While the normal dosage varies by specific NSAID, it is generally advisable to avoid them if you have kidney failure. Consult with a healthcare provider for alternative pain relief options. The dosing interval is not recommended due to the contraindication, and potential side effects include stomach ulcers, gastrointestinal bleeding, and high blood pressure, all of which can be particularly harmful for individuals with kidney failure. Number 9. Metformin. Metformin is an oral medication commonly prescribed to manage type 2 diabetes by lowering blood sugar levels. In patients with kidney failure, metformin can accumulate in the blood, increasing the risk of lactic acidosis, a potentially life-threatening condition. A study in the Journal of the American Medical Association (JAMA) in 2016 linked the use of metformin in patients with impaired kidney function to a higher risk of lactic acidosis. While the normal adult dosage of metformin for those with healthy kidneys is typically between 500 to 2,000 milligrams per day, dosages need to be adjusted for kidney failure. Consult with a healthcare provider for alternative diabetes management options if you have kidney failure. The dosing interval is typically divided doses with meals. And potential side effects include nausea, diarrhea, and a risk of lactic acidosis in kidney failure patients. 8. Contrast agents. Contrast agents are substances used in diagnostic imaging procedures, such as CT scans and MRIs, to improve visibility of certain tissues and organs. Like iodinated contrast agents used in imaging, intravenous contrast agents can be nephrotoxic and may worsen kidney function. A study published in the American Journal of Röntgenology in 2014 found a significant association between the use of iodinated contrast and the development of acute kidney injury in patients with kidney disease. Dosage for contrast agents is specific to the imaging procedure and patient's weight. Patients with kidney failure should discuss alternative imaging options or strategies to minimize the use of contrast agents with their healthcare providers. The dosing interval varies based on the imaging needs, and potential side effects include acute kidney injury and a decline in kidney function. Number 7. ACE inhibitors and ARBs. Angiotensin-converting enzymes or ACE inhibitors and angiotensin receptor blockers or ARBs are medications used to treat high blood pressure and certain heart conditions. However, these medications can dilate blood vessels within the kidneys, potentially causing a further decline in kidney function in patients with kidney failure. A study published in the Journal of the American Medical Association or JAMA in 2014 found that the use of ACE inhibitors and ARBs was associated with an increased risk of hyperkalemia, or elevated potassium levels in patients with kidney disease. Dosage varies by specific medication, but dosages should be adjusted for individuals with kidney failure. Patients with kidney failure should consult with a healthcare provider for alternative hypertension management options. These medications are typically taken once daily, and potential side effects include hyperkalemia and a further decline in kidney function. Number 6. Trimethoprim sulfamethoxazole. Trimethoprim sulfamethoxazole, often sold under the brand name Bactrim, is an antibiotic commonly used to treat various bacterial infections. In patients with kidney failure, Bactrim can increase the levels of potassium in the blood, leading to hyperkalemia, a dangerous condition. A study in the Journal of General Internal Medicine in 2017 reported an association between Bactrim use and the risk of hyperkalemia in individuals with kidney disease. Dosage varies depending on the specific infection being treated but should be adjusted for individuals with kidney failure. Patients with kidney failure should consult with a healthcare provider for alternative antibiotics. Bactrim is typically taken twice daily, and potential side effects include hyperkalemia and an increased risk of kidney injury. Number 5. Statins. Statins are a class of drugs used to lower cholesterol levels and reduce the risk of heart disease. In patients with kidney failure, statins can accumulate in the blood, increasing the risk of muscle damage and kidney damage. A study published in the Clinical Journal of the American Society of Nephrology in 2015 found that statin use in individuals with kidney failure was associated with a higher risk of myopathy. Dosage varies by the specific statin but should be adjusted for individuals with kidney failure. Patients with kidney failure should consult with a healthcare provider for alternative strategies to manage cholesterol. These medications are typically taken once daily, and potential side effects include myopathy, which can further worsen kidney function. Should you have any inquiries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. Number 4. Some antibiotics. Ciprofloxacin and levofloxacin. Ciprofloxacin and levofloxacin are antibiotics used to treat a variety of bacterial infections. These antibiotics can cause tendon damage and are associated with an increased risk of acute kidney injury in patients with kidney failure. A study published in the British Journal of Clinical Pharmacology in 2015 reported that fluoroquinolone antibiotics, including ciprofloxacin and levofloxacin, were associated with a higher risk of acute kidney injury in patients with kidney disease. Dosage varies depending on the specific infection being treated, but should be adjusted for individuals with kidney failure. Patients with kidney failure should consult with a healthcare provider for alternative antibiotics. These antibiotics are typically taken once or twice daily, and potential side effects include tendon damage and acute kidney injury. Number 3. Intravenous contrast agents. Intravenous contrast agents are used in medical imaging, especially in procedures like angiography to enhance the visualization of blood vessels. Like iodinated contrast agents used in imaging, intravenous contrast agents can be nephrotoxic and may worsen kidney function. A study published in the Journal of Nephrology in 2017 highlighted the potential risk of contrast-induced nephropathy in patients with kidney disease undergoing intravenous contrast-enhanced imaging. Dosage is specific to the imaging procedure and the patient's condition. Patients with kidney failure should discuss alternative imaging options with their healthcare providers. The dosing interval varies on the imaging needs, and potential side effects include acute kidney injury and worsening of kidney function. Number 2. Potassium supplements. Potassium supplements are taken to manage potassium deficiency or as part of a treatment plan for certain medical conditions. In individuals with kidney failure, potassium supplements can lead to dangerously high levels of potassium in the blood, which can be life-threatening. A study published in the American Journal of Kidney Diseases in 2016 demonstrated a specific association between potassium supplement use by hyperkalemia in patients with kidney disease. Dosage varies based on individual needs but should be strictly managed for kidney failure patients. Patients with kidney failure should consult with a healthcare provider to ensure potassium levels are appropriately managed through diet and medications. The dosing interval varies based on individual needs, and potential side effects include hyperkalemia, which can lead to heart arrhythmias and other serious health issues. Number 2. Proton pump inhibitors or PPIs. Proton pump inhibitors such as omeprazole are commonly used to reduce stomach acid production and treat conditions like acid reflux and ulcers. However, PPIs can contribute to a magnesium deficiency, which can be harmful to kidneys and may worsen kidney function. A study published in the Journal of Clinical Medicine in 2020 found that long-term PPI use was associated with an increased risk of magnesium deficiency in patients with kidney disease. Dosage varies by the specific PPI but should be adjusted for individuals with kidney failure. Patients with kidney failure should consult with a healthcare provider for alternative approaches to manage gastrointestinal conditions. These medications are typically taken once daily, and potential side effects include magnesium deficiency and worsening kidney function. When facing the challenges of kidney failure, it's crucial to be informed about the medications you take. As we've explored in this blog post, certain drugs can have adverse effects on kidney function and overall health. Always consult with a healthcare provider to ensure that the medications you are prescribed are safe and appropriate for your condition. Open communication and a thorough understanding of your treatment plan are essential for managing kidney failure effectively and improving your quality of life.